Mhm. Screen ಮಾಡಿದ್ರೆ think பண்ணு.
Hello, everybody, and I extend a warm welcome to our panelists and audience to this fresh episode of the Hindu Wellness webinar series presented jointly with Kauvery Hospital. And I apologize for the slight delay in start of the program. March 12th, that is tomorrow, is World Kidney Day, and this year's theme is Kidney Health for All, Caring for People, Protecting the Planet. With the day in mind, and also given the fact that kidney disease is a growing global challenge, we bring you today's webinar on a very basic yet important topic: kidney care, awareness, and prevention. Kidneys play a crucial role in maintaining our overall health, but any disease of the kidney strikes and progresses silently. All our panelists today are accomplished nephrologists from the Kauvery group of hospitals, and they will talk about the importance of early detection, the preventive measures, and also the common misconceptions surrounding kidney diseases. Before I introduce the three panelists for their respective presentations, audience, you may post your questions in the Q&A box as the webinar progresses, and I will try to take up as many possible questions with our experts towards the end of the webinar. Our first speaker is Dr. Shakti Selvakumar, consultant nephrologist, Kauvery Hospital, Cantonment, Trichy. After completing his MBBS from Sri Ramachandra Medical College, followed by MD from Sri Balaji Medical College, Dr. Selvakumar specialized in nephrology with the DNB from KG Hospital and Postgraduate Medical Institute, Coimbatore. Over the years, he gained proficiency in performing renal transplants and interventional nephrology procedures and providing advanced care to patients with kidney diseases. A member of Indian Society of Nephrology, Indian Society of Organ Transplant, National Academy of Medical Sciences, and European Renal Association, Dr. Shakti's expertise is in renal transplant and interventional nephrology. In his talk now, he will focus on the early warning signs of kidney disease, when to test, and when to act. Welcome, Dr. Selvakumar.
Thank you, ma'am. Shall I start my presentation?
Yes, please.
Can you see my presentation?
Not yet? Yeah, you have to.
Yeah, fine.
Yes.
So shall we start?
Yes, please go ahead. We're already late.
Good morning, everyone. I should say good afternoon. Thank you for joining. This is Dr. Shakti. I'm a kidney specialist and transplant physician at Kauvery Hospital, Cantonment, Trichy. For the next few minutes, I want to share something that could save your life or the life of someone you love. We're going to talk about your kidneys. The goal today is simple. I want you to know few things you can do starting tomorrow to safeguard your kidneys. Let me start by telling you why this matters more than you think. Let me give you this picture. Hold up a fist. This is the size of one of your kidneys. Imagine this filtering 200 liters of your blood today, every day, for the rest of your life. These two organs work around the clock, removing toxins, balancing blood pressure, maintain your bone health. You never feel them working. You never think about them, but they never stop. The question is, what are you doing to safeguard them? So, what happens when these silent workers start to fail? 1 in 10 people worldwide may already have a chronic kidney disease. And the frightening part is that 90% of these people who have kidney disease do not even know it. In India, we are facing a huge burden because most people arrive at the hospital only when their kidneys have already failed. So let me tell you about Mr. S, one of my patients, 34-year-old guy, IT professional in Chennai, busy life, young family, good salary, feels absolutely fine, no complaints. Fast forward a few years, still nothing, he's good, no pain, no tiredness, no change in urine. His body feels strong and normal, but inside, silently his kidneys are losing ground, failing gradually year after year. Then one day, he was breathless, had a checkup because his wife insisted, and the doctor says, sorry, your kidneys have failed. He cannot believe it. No warning at all. And now he choices dialysis 3 times a week, exhausting, expensive, transplant, major surgery, long wait, huge cost. This is not a rare story. I see many such patients walk into my hospital, my clinic every single week. Kidney disease is called silent because your kidneys are incredibly resistant. See this battery? This is what your kidney function looks like by the time you first feel unwell, almost empty. The healthy parts of the kidney compensate for the damaged parts, so you feel fine. You go about your daily work routine, but inside the damage keeps growing. A person can lose up to 90% of the kidney function before they feel a single physical symptom. By the time you get symptoms like swelling, fatigue, or changes in the urine, already you are at kidney failure stage 4 or 5. We look at 3 common myths and facts about kidney diseases. This is the most common thing which I hear in my clinic. Doctor, my urine looks normal, so my kidneys must be fine. It doesn't work that way. Your urine can look completely normal, clear, even when your kidneys are functioning at 40 to 50% capacity. A kidney disease is not something which you see in your bathroom. It shows up only in a blood test and urine test, then at a lab. The second myth, which I commonly hear, is I am too young to have kidney disease. I am too young to worry about my kidneys. I see 30-year-old patients on dialysis. If you have diabetes, high BP, or family history, your age is not going to protect you from kidney disease. In fact, younger patients lose more year in life with this disease more than older patients. The earlier you have the risk, earlier you should be checking yourself. And people say, if I drink plenty of water, coconut water, my kidneys will be fine. Water is important, I agree. But water cannot undo what your uncontrolled sugar is doing to your kidneys and your BP is doing to your kidneys. And coconut water, people think it's a healthy drink, maybe for healthy people. But if your kidneys are already weak and failing, coconut water can add high potassium to your blood. It is not a treatment. Controlling your BP and sugar is. So the question is, who should be worried? Who's at risk? Kidney disease doesn't pick people at random. There are clear risk factors. I want you to mentally check if you have any of these risk factors which apply to you. Number 1, diabetes, leading cause of kidney failure in India and worldwide. Number 2, high blood pressure. Number 3, obesity, excess body weight. Number 4, family history of kidney problems. If your parents or sibling had kidney disease, your risk goes up significantly. Number 5, history of renal stones, repeat urine infections. And number 6, being over 60 years of age. I'll give you 6 rules which will help you to protect your kidneys. Think of high blood sugar like a sandpaper running through your filters in the kidneys. Every time a sugar spikes, it scratches and scars those filters. Over years, damage becomes permanent. Rule is very simple. Control your blood sugar, watch your diet, take your medication as prescribed, work with the doctor to keep your HbA1c in target range. High BP is the second most silent destroyer. And notice I said silent because most people with blood pressure, high blood pressures, feel absolutely normal. Occasional headache can happen. This forces your tiny blood vessels in your kidneys to narrow and scar. Over time, kidneys lose the ability to filter. The target of BP should be 140/90, ideally around 120/80. My practical advice, to buy a simple home pressure monitoring. They cost few hundred rupees. Check your BP regularly, write it down, show it to doctor whenever you find time. That one simple habit can prevent your years of kidney damage. The number one way people lose the kidneys and damage the kidneys in Tamil Nadu is pain tablets. You won't believe. Not one tablet occasionally, that's fine. I mean, diclofenac every once in a while can help you, but taking pain tablets daily for morning body ache, for knee pain, damage your kidney week by week. These drugs choke your kidney's blood supply. If you need a safer option, paracetamol, lowest dose, shortest time can help. Not just painkillers, herbal powders, Instagram detox drinks, gym plus supplements. None of these are good for your kidneys. Some contain heavy metals, some contain steroids. Simple rule is that if any drug enters your body, your kidneys might pay the price. So choose wisely. Chronic pain, meet a doctor, get a diagnosis. Don't get endless supply of pain medications. Let me paint a picture of typical family lunch in Tamil Nadu. Sit down, add a spoonful of ghee, sambar, put on spicy and pickle on your food, cook instant noodles, take some packaged mixture in the evening. Without realizing, doing all this, you are actually consuming double the amount of daily salt your kidney can handle. This is not unusual. This is normal for many families. The hidden salt in bakery foods, restaurant gravies, and packaged snacks is enormous. Cook fresh food as much as possible. That is my rule 4. Use herbs and spices for flavor instead of mixing salt or masala mixes. Cut back on pickles, instant meals, and processed snacks. I'm not saying never eat all these things. I'm saying you should understand how much salt you're adding to your food. Limit all these things as possible. You do not need to run a marathon. My rule 5 is to maintain a healthy weight and stay active. Carrying extra weight or being inactive increases your risk of diabetes and high BP. Both can damage kidneys. Global recommendation is 150 minutes of moderate activity per week. This might look huge, but break it down. 150 minutes is just 30 minutes, 5 days a week. And you don't have to do 30 minutes at once also. Start with 10 minutes a day in the morning, afternoon, and night, which will help your digestion, blunts your sugar spike. Over weeks to months, this will compound to kidney health. So 10 minutes, 3 times a day equals kidney protection. Your body does give you some clues when you are having kidney problems. Do not ignore these changes. For example, your kidneys are the maintenance of the body fluids. When they start to struggle, gravity pulls extra fluid into your feet and ankles. You might notice your chappals feel tight in the evening. Your socks leave marks. Other signals like changes in how often you urinate, urine that looks foamy or discolored, or sudden severe pain of a kidney stone are all SOS signals which your body is sending. Do not wait, do not ignore, do not Google it. See a doctor if possible. People go for routine blood tests. Doctor says everything is normal. They go happy. But here is what they don't realize. My rule 7 is that get your kidneys tested when at high risk. Ask a doctor, should I check creatinine? Should I do a urine test? These tests are often left out unless there is obvious problem. So if you have diabetes, high BP or family history, do not assume your doctor have checked your kidneys. Ask them directly, please check my kidney tests. Say it like that every year. 2 simple tests can catch a kidney disease early. Test 1, simple blood test, creatinine, will show you how much your kidneys are functioning. Test 2, a simple urine test, look for protein leaks. If protein is leaking into your urine, it is an early sign that your kidney filters are being damaged. Both tests are inexpensive, widely available, can be done at any lab. If you are 40, have diabetes, have blood pressure, a family history, do this every year. You might think it's costly. Think about it. Both these tests hardly cost 500 rupees, less than what you spend on a family dinner out. Now, if my patient, Mr. S, has done this test 5 years ago, he probably wouldn't be having dialysis or renal transplant risks. And now dialysis costing around 40,000 rupees. And transplant, a risky surgery costing around 4 to 8 lakhs upfront. And lifelong medications. To avoid all these things, just a small amount can be spent for investigations. So when should you see a kidney specialist or a nephrologist? Don't have to see for every health concern. There are 3 specific signals. Persistent abnormal test. If your creatinine is high or protein is showing in your urine more than 1 test, do not wait. If your blood pressure is difficult to control even with medications, resistant hypertension is often a kidney problem which is a disguise. And third, protein leaks in the urine, unexplained swelling in your legs or face. Please do visit a nephrologist and do your tests if possible. Before I close, here is a simple card which you can photograph if possible right now. 4 everyday habits on the left, 4 kidney smart swaps on the right. You don't have to memorize all my rules, just do these swaps at home. Less pickle and packaged food. Stop self-prescribing painkillers or detox medications. Keep a BP monitor at home. Measure your BP regularly. Check with the doctor before taking any supplements or herbal anomaly. These 4 changes cost almost nothing, but they will protect the kidney for decades. If I forget everything else, just remember these things. Know your personal risk, diabetes, BP, family history. Protect your kidneys with daily fresh food, regular movement, avoid unnecessary medications. Ask your doctor for 2 simple tests, blood test, which is creatinine and urine protein, every year. That's it. 3 rules, almost cost nothing, but it can save your kidneys. Had my patient, Mr. S, had done this test, same jobs, same man, same busy life, but health screen will show a creatinine of 1.4, slight almond in the urine, doctor changes medications, gives him diet, little less salt, little more walking, regular follow-up. Few years later, his numbers are stable, he's eating well, family is healthy, and daughter is actually happy that father is doing well. No dialysis, no transplant, one blood test, one urine test, that's all it took. This is the ideal version of story I want every person who is watching today. It starts with two simple tests, doctor follow up. So I conclude my presentation. Know your risks, watch your salt, avoid painkillers, have always your BP numbers, follow yourself up. Ask your doctors for two simple tests, creatinine, urine test for protein leak. These small choices at your dining table and bedside protect your families against your kidneys for life. Thank you.
Thank you, Dr. Selvakumar, for that very beautifully explained presentation. Interesting facts and as well as little scary facts. Moving on to our next speaker, Dr. Shivakumar D. He's Senior Consultant Nephrologist, Kauvery Hospital, Vadapalani. He did his DM in nephrology from Kilpauk Medical College, MD in internal medicine from Madras Medical College, and MBBS from Madurai Medical College. An accomplished nephrologist with expertise in renal transplant, critical care nephrology, hemodialysis, and plasma exchange, Dr. Shivakumar was part of the pioneering team that performed the first ABO incompatible renal transplant in the government sector in India. He received international training through an observership in interventional nephrology in Dallas and is skilled in percutaneous CAPD catheter insertion, USG guided kidney biopsy, and vascular access procedures. His research focuses on improving chronic kidney disease outcomes, quality of life in transplant recipients, and the role of indigenous medicine in CKD pathogenesis. And also renal transplantation, swap renal transplant, and interventional nephrolog are his specializations. Prior to joining Kauvery, Dr. Shivakumar was assistant professor of nephrology at Madras Medical College and Royapeta GH from 2014 to 2025. He also held academic positions in SRMC Porur and SRM Kattan. He will now talk about the common kidney diseases. Welcome and over to you, Dr. Shivakumar.
Thank you, Ms. Basu. Good morning, everyone. Good day, everyone. I'll just share my slides to the screen. So, Dr. Shakti has set the stage very well, and he has spoken well about prevention and the tests that you need to do and the diet we have to follow. I'm just going to tell an overview of the common kidney disease we see, and so that if any one of you have or anyone close person has, we can identify and immediately consult and know what to be done. So first is the acute kidney injury. This is where the patient who is a person who is normal few days back suddenly has a decrease in kidney function. That means the creat goes up, or there may be a decrease in urine output, and which causes fluid accumulation in the body and the breathing difficulty. The intensity can be mild or severe to life-threatening. Commonly, nowadays, malaria, infections like malaria, dengue, leptospirosis can cause. And Shakti told painkillers can also cause acute renal failure, and severe diarrhea due to large volume loss can cause. And in elderly people, the obstruction due to the flow of urine can cause. The good thing about acute kidney injuries is usually irreversible. If you find the cause and promptly address it, it is usually irreversible. Next is chronic kidney disease. This is we define chronic kidney disease when the patient has abnormal renal function or increased albuminuria that is persisting for more than 3 months. These group of patients form the chunk of our nephrology practice, 80 to 90%. The sad thing is it is usually progressive, irreversible decline in renal function. And fortunately, we have got good medications to reduce the rate of progression, and that is almost equal to giving almost near normal life. And obviously, diabetes mellitus is the commonest cause of this chronic kidney disease. Other causes include high blood pressure, glomerular diseases, renal stone disease. And in the Indian subcontinent, we have a condition called CKDU, where the U represents unknown etiology. The kidney fails for no reason for this. I mean, there's no definite reason. The posterior things are they are commonly seen in agriculture workers who are exposed to heat, stress, dehydration, and the pesticides. Sometimes some kidneys are familial and some are congenital. Next slide. Nephrotic syndrome means you have a large amount of protein leaking in the urine. and that produces frothy uniform urine, and you have a leg swelling and periorbital swelling. It is more common in pediatric age group, 2 to 12 years, and most of these children do not progress to chronic kidney disease. This nephrotic syndrome also happen in adults, not though very common as in children, but adults will definitely require a kidney biopsy for appropriate management. So nephritic syndrome, don't be confused with the terms. It is a protein leak with blood in urine. The blood may be visible to the eye, or it may be detected by microscope. So the symptoms are the dark brown urine or a cola colored urine. Patients have leg swelling, they have high blood pressure. In children, it's commonly seen after a trivial infection of the skin or sore throat. Young women, we always like to rule out autoimmune disease like SLE. And whatever be the thing in adults, as a nephrotic syndrome, they usually require kidney biopsy to know the exact cause and severity and guide appropriate treatment. Urinary tract infection. This is infection of the urinary tract, anywhere from the kidneys to the external urethral opening. People may not be aware, this is the commonest cause of sepsis and ICU admissions worldwide. Females in the reproductive age group, diabetics, and the elderly people are vulnerable for urinary tract infection. And one class of medication that has revolutionized care of diabetes, heart, and kidneys, the SGLT2 inhibitors. They work by sending excreting the glucose via the urine. So there is a risk of urinary tract infection with these drugs. So the risk is minimal. But whenever you have developed a UTI with these drugs, you stop the drug and consult your doctor. Cystic disease of the kidney. Many patients come with a scan showing a cyst, and they are very much bothered. You cannot ignore. You cannot be very much bothered. We just go decide when the cyst came, age of onset, whether it's present both the kidneys or there is associated pain or blood in urine. Then ideally a CT is the best modality. CT scan is done to know the cyst and find out the nature of the cyst, and the follow-up is based on the nephrologist advice. We advise what to do. Renal stone disease. If you would experience the severe pain of the stones, there's usually the pain radiates from the back to groin, and they may have past blood, or sometimes the stone comes in the urine. They also have symptoms like vomiting, usually common in young males, summer. There is usually family history also. The simplest thing is for all patients with stone disease, take less salt and you make sure that you stay hydrated throughout the day, not drinking 1 liter in the morning and 1 liter in the evening. Keep yourself hydrated throughout the day. And cardiac kidney metabolic syndrome. This is a new identity because it's gaining popularity because we have 4 diseases grouped as a single syndrome. You have a heart disease, you have a kidney disease, you have diabetes and obesity. Why? Because the one disease, one system gets bad, the other it pulls the other system. So we have to address as a whole. And with the increase in obesity, we are seeing a lot of patients with simultaneous sugar, heart, and kidney disease. Basically, we want to screen everyone with above 30 with a beam of more than 23 and make sure that the heart is fine, the kidney is fine. And if it is need recurring treatment, we treat them with reducing calories, weight reduction, control of sugar, BP and cholesterol, and control of albuminuria. So the World Kidney Day 2026, the theme is Kidney Health for All, caring for people, protecting the planet. So this is a good ideal podium for us to spread the awareness and advocating prevention to achieve the goal. Thank you.
Thank you, Dr. Shivakumar, for your presentation. Before we move on to the final speaker, I once again request the audience to start posting their questions in the Q&A box. Dr. K. Abhirami, Senior Consultant and HOD Nephrology, Kauvery Hospital, Salem. She obtained her DM in nephrology from All India Institute of Medical Sciences, Delhi. She's a member of the Royal College of Physicians, UK, and has also completed a fellowship in nephrology from University of Toronto, Canada. Dr. Abhirami has been with Kauvery Hospital since 2019, and prior to that, she worked in Sri Venkateshwara Institute of Medical Sciences, Tirupati, and SPMM Hospital, Salem. With more than 2 decades of experience, her professional interests extend to critical care nephrology, epidemiology, preventive nephrology, and electrolyte disorders. She specializes in advanced procedures such as hemoperfusion and plasmapheresis. Dr. Abhirami's presentation is on renal replacement therapy, the myths and the facts. Over to you, Dr. Abhiram.
Good morning, everyone. Thank you, Ms. Basu, for that kind introduction. Dr. Shivkumar, you will need to stop sharing so that I can start sharing.
Yeah, I'll do it, sure.
So when we're waiting
Please.
for the screen to, yeah, thank you. Good morning. So today I'm going to talk about renal replacement therapy. As it is, Dr. Shakti has alluded to about this a little bit in a negative sense, but I want to bust some of the myths associated with renal replacement therapy. So what is renal replacement therapy? When the kidney function declines, when it is less than 15%, it goes through multiple stages, stage 1 to 5. And 5 is when the kidney function is less than 15%. At that point, it is not enough. The failing kidney is not able to do its job, and then we'll have to replace its function in some kind of therapy. What are the options we have available? We have mainly two different kind of options. One is dialysis, and the other is renal transplant. Dialysis again has two different ways. One is the blood purification, which you are all aware of, where you have to go to an hospital and get it done 2 to 3 times a week. But there is another option of a home dialysis where you can do it at home. There is a catheter in your stomach, and you just use some fluids like IV fluids, and that will help in removing the waste products from your body using your own natural membrane in the abdomen. This is less popular and people are not aware of it, but just wanted to point out that. The second option is to go for a renal transplantation, wherein a new kidney is placed and the native kidneys are not usually removed. So these are the only options we have when the kidney function is less than 15%. Though that seems very bleak, we should understand kidney is the only organ where, with the help of these kind of therapies, anyone with a failure can live many, many years, even decades, and not just live, but a good quality of life. So the certain myths I want to break is people think dialysis is very painful. That's not true. If you have an AV fistula, at the time of the start of the dialysis, when the needle is placed in, it could be just a minimal pain. It's something like a blood test. But after that, treatment is very comfortable. Most of the centers have televisions. There are centers with chairs. You can sit, watch, do your work, and get dialysis done. People think dialysis makes you weak. That is not true. Actually, once you start on dialysis, your appetite will improve, you'll eat better, and that the tiredness also will come down. You'll start feeling more energetic. The third myth is that dialysis is permanent. Once you start, you cannot stop. See, Dr. Shivakumar had mentioned there are different types of kidney failure. One is which happens within days. That kind of kidney disease will improve. And if it improves, we can stop dialysis. What people say is, once I start dialysis, I will need it lifelong. So I don't want to start dialysis. That's not true. Once you're on dialysis, people think you just need to go to a hospital 3 times a week. There is no life. There's no work. That's not true. Most of the units offer very flexible dialysis timings. And you can travel also. Like someone in Salem can go to Chennai, get dialysis there for a couple of days and come back. And most of us offer dialysis even in the nights if they are working. Patients are generally very fit and are able to work, except the older patients. And people think you need to go to a hospital 3 times a week and your life is tied to one hospital. That is also not true. As I mentioned earlier, there is something called a peritoneal dialysis, which you can do at home, and it's very easy and you can continue with your regular lifestyle. Dialysis cures kidney disease. This is something I would like to inform because patients come and ask me, I've been on dialysis for a month and my numbers are still the same and my kidney is not better. Dialysis does not cure the kidney disease. It does the job of the kidney, but that also not done completely. Mainly the filtration function of the kidney alone is replaced using the dialysis. Sometimes people say my relative is very old, very weak. He cannot stand dialysis. That's not true. In every age, dialysis improves quality of life and survival compared to not being on dialysis when you need it. So current dialysis machines and methods are quite safe. It can be done for everyone. And patients who are on dialysis, that's the opposite end of it. So I feel too good. I'm eating well now. Urine output is good. So I'll go for dialysis once a week, once in 10 days when I'm not feeling well. That is not correct. You should get dialysis 2 to 3 times a week according to what the doctor suggests to you, because that dialysis has made you feel better. Stopping it is going to make you sick again. So you cannot go yo-yo, feeling better and then again becoming sick. The last thing, but not the least, I've not mentioned it here, but most of the patients ask me dialysis is equal to death. That's not true. With dialysis, you can live for many years and decades also, with proper management of not just the kidney disease, but the associated problems like your blood sugar, your heart problems. You take good care of all those, you can live for many years and decades also. But having said all that, dialysis, as I said before, replaces only 15% of the kidney function. So kidney transplantation is the treatment of choice once you reach stage 5 CKD. If possible, if you have a donor, we should do it. So I just wanted to state some facts about kidney transplant. So who can go for transplant? Any patient with CKD, which is that stage 5, when the function is less than 15% of normal, can go for a transplant, provided that kidney disease cannot be cured and they do not have any other organ disease which is not reversible. So you can have a heart problem. If you can undergo a bypass, then you can still undergo a transplant. Only if the other organ problem is not treatable. If you have some kind of cancer, those kind of things alone. And age is not a limit. Actually, older people benefit more from transplant compared to dialysis. Who can be donors? In India, we have very strict regulations regarding that. There are 2 types of donor. One is the live donors. Live donors can be your own family members, that is relative donor, or emotionally related person to you, a close friend, a family friend, or a brain dead donor. That for that you need to register in a center which is approved by the government, and then that waiting list is maintained by the government. In Tamil Nadu, it is by TransTan. It's a transplant organization for Tamil Nadu. So based on that, the organs will be allocated. There is no favoritism. Even if I want, I cannot bypass the list and get a kidney immediately. So it is very transparent and it benefits a lot of people. So where to get kidney transplants? So if you have a live donor, you go to an hospital which is registered for transplant. There are a lot of regulations about hospitals which can do transplant. That is for your own good. So government has made multiple checkpoints so that you get safe and effective treatment. And for the brain dead donors, again, those centers which are registered, you can register there. And once the kidney is allocated to you by the government, the transplant can be done at your own hospital. How is the surgery done? We should remember.
Ma'am, your slides are not moving.
Oh, I'm sorry.
We are stuck at the first kidney transplantation, some facts slide.
Okay. So, can you see it now?
No, we haven't yet moved on to the next slide.
Shall I stop sharing and start again?
Maybe you could try. We are at the slide, you can see, I guess, on your screen, kidney transplantation, some facts.
Yeah.
So we are stuck at that slide.
Okay.
Yeah.
Okay. Yeah. I'll move now. Okay. This is the slide I'm talking about anyway. How is the surgery done? We don't remove the kidneys.
It's again the old slide only. Okay, how is surgery done? Right, the last point.
Yeah. So how is the surgery done? Important fact to remember is your kidneys are not removed. Just one kidney is placed in the lower abdomen, and that kidney is enough. Because one kidney function is enough only, we are able to do a live transplantation, because the donor can survive, can live well with one kidney. So they donate the other kidney to the relative. Some facts about transplantation in Tamil Nadu. As of today, there are 6,164 patients waiting for a transplant from a brain dead donor in Tamil Nadu. To put it in perspective, in 2025 statistics is not complete yet. Totally 1,987 renal transplants was done from live donors, and 449 transplants were done from deceased donors, okay, from brain dead donors. So in spite of this, the number of people waiting is 6,164. That's because people keep people are added on to the list every day. These numbers are not good. What it means is an average person waits for 3 to 5 years to get a kidney. Whereas in Tamil Nadu, statistic is about 18,000 road traffic accident deaths happen every year. So if many of us pledge our organs from the when we are alive, then at the time of a brain death, in case there is an accident, there is a brain death, then that organ can be used, not just for 1 or 2 patients. It can help 8 to 12 patients, because one brain dead donor can give 2 lungs, 2 kidneys, a heart, liver, pancreas, intestine, bone, skin, eyes. So you can save so many patients. These statistics, in spite of Tamil Nadu being the top performer in the brain death donation in India, in spite of it, there are so many patients waiting. So I want to leave with just a message that organ donation pledge we should all take, so that when something happens to us, we can live on another 8 to 15 people. Thank you.
Thank you, Dr. Abhirami, for that very crisp presentation. I'll start with you by asking, if we have two situations, say, what would you how would you describe it? See, one person has a healthy and safe kidneys, and as you said, a beloved close family member donates a kidney. So how does one keep the other kidney safe? And also, on the other hand, the person who's receiving the kidney, where perhaps one kidney is already compromised, what are the chances of reducing further risk of kidney-related complications in the second kidney?
I'll answer it in 2 parts. First,
Yes.
regarding the donor. So the donor is evaluated extensively, not just the kidneys. We evaluate all the organ functions of the donor, and we take someone as a donor only if they are absolutely healthy and we don't expect any problems, at least for next 20-25 years. So in spite of it, okay, you are living with a single kidney. So the main precautions to take is avoid unnecessary medications, control your weight, don't gain too much weight after donation. And the other thing is to check for your blood pressure regularly. Blood pressure is the only thing which can happen in a donor, slightly more than the general population. So keep checking your blood pressure. And most of the transplant centers, including us, we do free evaluation for our donors regularly. When the patient comes for checkup, we ask the donors also to come. We do checkup first month, third month, 6 months, and then annually. And it is done free of cost in most of the transplant centers for the donor, because we honor them for the altruistic act they have done. Coming to the patient, there are 2 groups of patients. There are some patients who have diseases which can come back in their kidney, depending on what kind of disease bothered you. So those kind of patients are well counseled before transplant, and then appropriate precautions are taken after the transplant, and follow-up is done so that it's caught early, not like your native kidney when it was silent and we didn't know. But here, patients are on regular follow-up. Even if that disease comes back, it's picked up early and appropriate treatment is given. And the second most important thing is the main risk with the new kidney, our body doesn't accept anything for it. So it's going to reject, it's going to say, this is not mine. So to prevent that, medications are given at different doses at different time. Patients sometimes, after a few years, become very complacent and sometimes do not take their medications in the right time and the right way. That should be avoided. If they, after this is something we normally see after a few years, they become very satisfied, and so they should avoid doing that. So continue the medications as prescribed, continue the follow-up as prescribed. After a couple of years, it's usually only once in 3 months. I think it's worth spending that much of time on in following up your kidneys.
Right, thank you. Dr. Selva Kumar, you very beautifully explained, the function of the kidney, and yet we end up abusing the organs so much. And you said there are just 3 simple things which people have to do, which was a blood test for that creatinine level, and checking the protein leakage in urine, and of course visiting a nephrologist. Where do you think, and why, why have we failed in raising the simple awareness among people? We have say our polio drop campaign or even the AIDS campaign have all reached out to masses and people have got. So why not the kidney? What is it lacking in our awareness program regarding kidney?
It's a very good question, ma'am. Because people get scared more of cardiac diseases and communicable diseases, but if you ask me, chronic kidney disease is spreading like an epidemic. I think the other nephrologists also would agree. As per the years past, the more number of patients whom we see every day is getting increased, and we see young patients landing up in dialysis more often. So I think the government has recently announced a master checkup for poorly label patients. I think it is our duty to screen each and every patient who was having possible risk factors for kidney diseases as early as possible. And that way, you can catch a disease early, prevent its progression, or at least give proper counseling for dialysis or renal transplantation.
Dr. Shivakumar, Rubina Koshi is asking that diuretics are prescribed as part of BP management and control. But does long-term use of diuretics impact the kidney functioning? And if so, then what is the alternative?
Not exactly, ma'am. If you can take diuretic if only if there is edema or if the BP is not controlled by your routine medications, and we usually monitor the other parameters. Diuretic per se rarely damages the kidneys, ma'am.
Dr. Selvakumar, would you like to take this one? Like, a lot of youngsters go to gym and they are all into these protein shakes and they're all the time eating these, like meat products or the pulses, rajma, chole, and all the time in excess, perhaps. So the uric acid increases, and D. Shankar is asking whether uric acid increase is causing kidney problem. Do the symptoms show up? I can't see Dr. Selvakumar, but maybe Dr. Abhiram, you could continue.
Yes. Hi. Okay, Dr. Shakti, please go ahead.
No, continue, no problem. I'll have the next question, ma'am. No issues.
Anybody, all of you are equipped to answer the questions.
Shakti?
Yes, ma'am. No, we can start, ma'am. Answer the next question. No issues.
Okay, high protein intake is associated with high uric acid, but not in every patient. There are some people who are not able to metabolize the uric acid as well as the others. But overall, my advice is don't go for any dietary fad. So something which is a balanced diet, which has been there for decades and centuries, it's been time tested and it works out well. So I do not know why this new fad of just eating protein and not eating other things. But regarding the gym goers, the more concern for me is the additional supplements which they take, not just the diet change, but they also take these anabolic supplements, and we have seen patients coming with kidney diseases because of that. So my advice is don't take that, and anything is fine in moderation is good.
And there's a reverse question. Sorry, yeah, please go
I
ahead.
agree with Dr. Abhirami. I mean, better to avoid supplements and proteins. Yeah, gym goers definitely require a higher amount of protein depending on the muscle workout they do. So they are recommended up to 2.4 gram per kilogram. But if they have that, they do that intensity, that the protein is required, and it is better to take from a good source like what you take regularly, not from a source that you buy and the quality of which you are not sure of.
Because youngsters also say the coaches tell them that as long as you take these drinks and you are able to burn out, work on your muscles, it is fine. So there's a lot of this kind of misinformation. So that's why I was.
And hydration also plays a major part, man. So people, they work out more, but they don't drink water. And I've seen 2-3 cases of rhabdomyolysis. I mean, that muscle breakdown causing renal failure often. So if youngsters who are working out often, better in the areas like Trichy, better hydrate themselves. That is also a major point.
So there's somebody has presented another reverse situation where protein intake has to be increased. Like Nikhil from Mumbai says that his mother has controlled diabetes and BP, but she's currently on catheter with recurrent UTI. And she's also bedbound since 2 years due to polyneuropathy. She has protein in urea, creatinine is 1.24 and weight is 35 kilos. Sodium is 131, HB is 9.5. Her total proteins and serum albumin is low. Doctors have asked to give salty foods to increase sodium and 20 milligrams of protein powder daily. But she has severe constipation and muscle loss due to malnutrition. Should my mother's protein intake be increased, and whether she can really consume salty foods and biscuits? Because there are often, these dichotomies in.
So definitely, she is very much malnourished and she requires a higher protein for her recovery. First, the thing is she has to recover from her illness, and then we can take care of the kidneys. That's the way we have to take it. She's bit has critical illness, severe malnutrition. That has to be addressed first for her.
I think she must be having a renal failure also.
Yeah, 1.5
Even in patients with kidney disease, we do not advise protein-free diet.
restriction.
Okay? Protein should be taken at least 0.8 grams per kg. So yes, protein should be taken. She's malnourished. I think she must be having a problem. This is something we see in older patients where they are not able to retain their sodium. They have a sodium leak in the urine. This is quite common in older patients who are bedbound. So that must be the reason they would have advised increased salt, because she's excreting that salt in the urine. We call that SAIDH. So yes, please, Mr. Nikhil, you should listen to your doctor's advice regarding this.
You're right.
For
The
35-year-old
GRs
lady, her creatinine 1.2 being it's comparatively might be
No,
indicating renal
she's
dysfunction.
she's not 35-year-old lady. Her weight is
35
35
kg.
kilos.
35 kg.
Weight is 35.
Weight is 35. Creatinine 1.2 for a 35-year-old lady, 35 kg lady is bit high, ma'am. So
Definitely
she
high.
might be having renal dysfunction.
That is why he's asking that question, whether she can take more protein. That is why I said, in spite of kidney disease, she should be taking more protein
Yeah.
than what she is now.
Because she's too malnourished.
And these are very personalized, and I'm sure your
Yeah.
doctors can advise exactly how much you should be taking.
Dr. Abhirami, Suresh Epai wants to know, is giving cyclosporin mandatory for renal transplant patients?
Yes, it's not just cyclosporin. There are a group of medicines called CNI. It is cyclosporin, tacrolimus, everolimus. One of these drugs, it's better to have one of these drugs in the transplant regimen. Without that, the rejection rates are very high. There was an era when transplants were done without those drugs. Patients did survive, but still, in the current era, transplant without CNI is not advisable.
Mm-hmm. So Ravi Kumar is talking about a really, high creatinine level of 5.45. His urea is 44, uric acid 7.2, no protein leak in urine, non-alcoholic, non-smoking, vegetarian. Blood flow is normal, all scans are normal. Still, he says his creatinine has increased to 5.4 in the past 1 year. So what could be the reason?
If it's asymptomatic, it should be is not very much symptomatic, it should be a chronic kidney disease. Over the 1 year, the creatinine is going up to 5.5. Definitely, he should be having a chronic kidney disease, and it is better he consults the doctor and follows his advice.
Shankaran
Until the diagnosis,
Singaraman.
the follow-up.
So Shankaran Singaram is asking whether regular application of diclofenac spray for body pain affects kidneys.
Spray, I don't think that will create a problem. He's taking diclofenac tablets regularly, popping pills regularly, that might cause renal issues. Spray might be innocent.
So far, there has been no case report also from kidney problem from the spray. So spray drug is usually not absorbed into the blood.
System.
It should be fine.
Is there any way that one can avoid dialysis if a patient is now in stage 3A/3B? Pon Sharmila wants to know.
Yeah, we have
Depends
got
on the reason
medications.
for which he had.
Go ahead, Shakti. Go ahead. No issues.
It depends on the reason for which he's having renal failure. Is it a diabetic patient or a hypertensive patient who's having this chronic renal failure, or is it an acute or chronic disease? And has he been biopsied? And what was the chronic damage in the biopsy? It depends on all those factors. Creatinine is just an indicator of it's like a snapshot of whatever is happening at present. So I think we'll need a long-term to tell long-term prognosis. We need long-term data.
Patient with a stage 3 kidney disease should be doing two things. First thing is to consult a nephrologist, of course. One is their basic disease. If it is treatable, the doctor would treat. Even if the basic disease is not treatable, there are medications to slow the progression of kidney disease. And instead of having a nihilistic view on that, should go for those treatment to delay at least the dialysis options. And there is another interesting statistic. Most of the patients who are in chronic kidney disease stage 3 do not go on to dialysis. Many of these patients progress very slow. Some of them actually have other diseases like heart problems and things like that. So need not be so nihilistic. Though
Right.
the stage 2, 3 CKD numbers are huge, not all of them progress to stage 5.
And
So
there are
there are
there are really wonderful medications to usually previously if the rate of progression from CKD 3 to 5 was say it was 5 to 10 years. Now it has, with the medications that are available now, it has gone up to 25 years. That is a big achievement that we are seeing now. So let us, Dr. Abraham told, let us not be nihilistic.
There are a couple of diet related questions, like when somebody's creatinine is high. So, are there also any common myths about food, like certain fruits can't be taken, vegetables have to be avoided, fresh juice, things like that? So, if you could, one of you could just
The
talk about
common
it.
myths I see are two. One is avoid total salt, which is not true for everyone. There are patients with kidney disease who are in a salt losing state. So listen to your doctor's advice on the amount of salt you need to take, and again, the amount of water also. Not all kidney patients need to drink less water. Actually, what to avoid is there are not many myths around that, but there are many myths around what to take so that your kidneys become better. I'm sorry if I'm going to use a couple of Tamil words. People are fond of soraka and the varatand. I mean, the plantain stem and the bottle gourd. So I don't think it helps anyone. So need not go for that kind of food thinking that is going to help your kidneys. As I said earlier, depending on the stage of kidney disease, your body weight, whether you're in a salt losing state, what is your urine output, doctors generally give a tailored prescription for every kidney disease patient. So please don't listen to what your neighbors are saying. Listen to the diet chart which is given to you. That'll work well.
Yeah, I know what's the WhatsApp University saying, because this gourd water, that Loki water had become very popular in between at
Yeah.
people. Dr. Shakti, Dr. Selvakumar, there is a question, I think, from your patient only, Vivek Ethuraj, who's under your treatment at Cantonment. And he says that his serum creatinine is 1.37 and his BP is controlled. Everything seems to be under control. My question is, I started walking to reduce weight. If I join gym now, will it harm or stress my kidneys? And will it affect the creatinine levels in any way? I have also cut down on my salt intake.
Actually, he's doing good. I think going to gym actually will improve his metabolic profile. It will reduce insulin resistance. It will control his blood pressure. Just that he needs to be hydrated. As I just mentioned, Trichy is like a humid, warm area. So most of the people forget to get themselves hydrated while going for a gym or doing any hard workout. If he's doing that, I think it's more than enough.
Okay, there are too many personal questions. Actually, everybody's sent their readings and wanting. I think I will
That may
avoid
not be.
couple. Yeah, I know. So, Sai Shetty wants to know what is the average lifespan for the healthy kidney, and also the lifespan of a donor's kidney in a recipient's body. Dr. Abhiram.
Lifespan of donor kidney is easy to answer. So after a transplant, we say average of 10 to 12 years, but patients generally survive. I mean, without going on dialysis, most of the patients do survive 15 to 20 years. Like after 10, 12 years, even if the kidney starts declining, then that kidney would still work for many years. Regarding the native healthy kidney, it depends. If you don't have any disease, it should last your lifetime.
Mhm.
I think
Yeah,
the
so
maximum
yeah.
recorded record graph time is 25 to 30 years. Can go to maximum. That was the record. In 1975, there was a renal transplant recipient from UK who survived even to 2000s with his mother's kidney. And so when the mother was donated, he was actually 65. So by the time this guy died, the graft kidney, the age was actually 105.
Mhm.
So that was the maximum survivable kidney. It depends from patient to patient, but I don't think donors have to worry about that. I've not even seen any donor who's having renal dysfunction so far.
I think they
Uh,
want to know what is the survival of the graft in the recipient. If
Recipient.
the question is about the donor, please don't worry, your
Yeah.
kidney will last your lifetime.
Definitely. Or else you are not going to take your kidneys, one of your kidneys.
Otherwise, we will not take the kidney.
And all
Yeah.
these things Dr. Abdul was talking was average. As Dr. Shakti was
Yeah.
telling, we have seen patients on 30 years. 30 years, we have a patient was the early transplant in KMC. He did in 80s. He's still holding on. Literally 90s, early 90s. So she was talking about the average.
So, Dr. Saravakumar, since we have been also talking about hydration, Wendy wants to know, just by drinking water, can urine infection be cured? And what happens if urine infection is neglected for a little longer time?
Urine infection is neglected, then the next step is they'll go for sepsis. So by hydrating themselves, urine infection can be not, I wouldn't say mitigated, but supplements do help. Medications do help.
And what are the symptoms of urine infection? Same person
They'll
is
have burning
asking.
micturition, they might have chills, they might have active urine discharge. But other than that, whenever they have symptoms, early treatment will always help better. I've seen patients neglecting urine infection for months together, landing up in pyelonephritis, and we've even done nephrectomy for certain patients. So ideal would be to visit your doctor as early as possible to get a proper consultation.
Then there are a couple of questions on what type of medicines actually affect the kidneys. So I do not know. This seems to be a very
That's
broad-based.
a huge list.
Huge
Yes,
It'll be
list,
huge
yeah,
list. I don't
but
think we can cover this.
it's possible to, yeah. So does drinking this filtrated water, RO water, does that affect the kidney in any way?
No, ma'am.
No, it'll actually help the
No.
kidney.
Sorry? It's
No,
helping.
no, that
It's a
would
no, clear
no,
no.
no, no.
Okay. Role of microprotein in kidney diseases. What is the difference between microalbuminuria and microproteinuria?
I think he's meaning to ask about the difference between albumin and protein in the urine, right?
Probably. I mean, the question is framed like that.
We
I thought
usually
maybe
screen
some
for
doctor was
albumin.
asking.
Albumin is the initial protein that leaks in the urine. If you have a diabetic patient or any younger recipient with proteinuria, I mean, younger patient with proteinuria, you should look at the albumin. It's a very easy test to screen. The difference between albumin leak in the urine and albumin is a type of protein. So we look at the difference between these two, protein creatinine ratio and albumin creatinine ratio. It should be going to, it could be current. If there is discordance, which means the albumin is not leaking. There is some other protein which is leaking in the kidney. That's a different topic altogether. So we'll look at malignancy evaluation, all those things. To simplify, albumin is a type of protein.
I think the other answer could be protein comes late, microalbumin comes early. So if you want to pick up early disease, you should look for microalbumin. And once you have protein in the urine already, then the disease is a little more advanced than having microalbumin. So it would be good if you pick up your disease at the microalbumin stage.
So likewise, a lot of people also take continuous calcium tablets, or they are on those vitamin D doses. So Yasmin Begum is asking whether hypercalcemia leads to renal implications.
Definitely.
In a normally
Because
functioning kidney, calcium, whatever you take, will get usually excreted. But if the kidney is not fully normal, then yes, you can get hypercalcemia. I have seen patients with hypercalcemia. So, as I said before, there's a Tamil saying, no, அளவுக்கு மிஞ்சினால் அமிர்தமும் நஞ்சு. So, don't take anything too much. Don't take any supplements unless it's advised. Take a balanced diet. Everything will be there in the diet. So, why go for fancy multivitamins and calcium tablets? So the only role for calcium supplementation regularly is in an older patient with bone frailty, which the doctors prescribe. So,
And what is the difference between plant-based proteins and animal-based proteins? I mean, in terms of impacting kidney health. Dr. Shivakumar, would you like to take that?
yeah, ma'am. Plant-based protein are relatively light on your kidneys. the acid content of the plant-based proteins are really less. So for a kidney safety, it is better to go in for a plant-based protein and avoid animal-based protein.
One point I'd like to add, Sas Medikit, that
Sure.
there is no study to compare like
You're
this
right.
for healthy individuals. But for patients who are having CKD, to reduce animal foods is better. So because the acid load, as I said, it's more with animal foods. The uric acid is more with animal foods. So as I said, the urea generation, everything increases with animal proteins. So it depends on what stage of CKD they are in. And at the same time, as one of the patient mentioned, protein malnutrition is also a problem. Don't restrict too much proteins. Meet your doctor, meet a dietitian, have a balanced diet. That is more advisable rather than plant or animal mainly.
Chetna has a question about her brother who was born with a single kidney. Born with a single kidney. So, what precautions have to be taken and what are the life risks? She hasn't mentioned the age of the brother.
Age is not
10%
mentioned. Okay.
patients we see with single kidney, ma'am. That shouldn't be an issue, but you should be more precautious. And I don't think that will affect the GFR or kidney function in any way.
No specific precautions, ma'am. Just go on with the life. That should be, because they are like any other donors, live donors. They live with one kidneys, just like that. They almost live a normal life.
Mhm. Can antibiotic drugs be given to CKD patients?
Some of them, yes, some of them, no. And most of the drugs which you give are, come out of the body through the urine. So once the kidney function comes down, even if it is an acceptable drug in kidney disease, the dose will need to be modified so that it doesn't accumulate in the blood. So again, only based on advice.
Dr. Shakti, you have to again tell about the water intake, because a couple of questions on when we say keep yourself hydrated, what exactly it means, how much water is needed on a daily basis. Some say 4 liters, some say 8 liters. So, and what is also the right time and way of taking water?
Again, it depends on the place where you work, the place where you dwell. It's in the humid areas like in Trichy or central Tamil Nadu, where the temperature is high in sunny areas, and you have to take comparatively more water intake. I'd say minimum of 3 to 3.5 liters would suffice. But if you're working in, let's say, a factory where you're exposed to more heat, more humid area, your water intake should increase comparatively. I'd say urine output should the water intake should be matching your urine output plus at least half liter extra. That would be an ideal way to proceed.
Yeah, so this was again a
take on
related
this.
question.
Also,
Sorry,
another way of putting it is you can just advise the patient to have a urine as clear as water.
Water.
So
Exactly.
that's a simplest sign. That's a better way, because sometimes in a very cold time you don't have the thirst, you don't have sweating. You do not take 3 to 4 liters, but you are in a very hot, humid area. You may even like a 6 to 7 liters. Every time you pee, you make sure that the urine is as clear as water. It will make rid of your stones and even infection sometimes.
I was going to say the same thing. Listen to your body. You will
Yeah,
feel
you're
the
right.
thirst.
Yeah, I
Please
know.
drink when you feel the thirst. Don't postpone. And
Yeah.
urine should be clear to light yellow. If
Yeah.
it's too dark, then your water intake is not enough. There is no
Yeah.
single number. This 10 glasses of water and all is a myth.
So what we're seeing in Chennai is many people, IT workers who are in their who work in the AC throughout the day, they don't get the thirst. They drink very little water, even less than a liter for the whole day. Ma'am is drinking now, less than less than a liter per day, and they come with stones. So the hydration is determined by so many things, and make sure that you pass a clear urine. That's the simplest thing, I would suggest.
Yeah, I've also heard about the same for school students. I mean, children who don't drink enough water, and
Yeah.
even at that age, I think they get it. So there was this question about alcohol. We know damages liver, but does drinking alcohol damage kidney also, and or does it have any impact on renal functions?
Not directly, but
Depends
it can.
depends
Yeah.
on the
Yeah,
volume
go
and
ahead.
the quantity and how long they have been drinking.
Like that.
I'd say avoid it. Why take the risk?
Alcohol can cause increase in blood pressure. So indirectly, it can cause kidney problem. And the second thing is patients with sugar disease, like diabetes. If they take alcohol, the sugar control becomes very difficult. That can also indirectly affect the kidney. Though it doesn't directly affect the kidney, but still, I think liver is as important as kidney. Please don't take alcohol.
And do CKD patients need iron supplements for improving RBC count and HP for lifelong?
Depends on the iron levels in the body. Usually, we don't give iron supplements straight away. If they are having iron, low hemoglobin, initially it depends on the staging of the kidney disease. We give erythropoietin or oral supplements. After that, even after that, if it's not getting resolved, we usually check the iron levels. The risk of iron overload in patients also. Unnecessarily, we don't give supplements usually. So, your take, sir?
Yeah, patients on
Patients
dialysis,
require
we
iron.
usually, dialysis will require periodic supplementation. That too, as Dr. Shakti said, we also monitor the iron stores and replenish it. But a patient on dialysis definitely will require iron supplementation.
Most of the
Preferably IV
kidney
again.
disease patients in advanced stage would require iron.
What is the best test or scan for hydronephrosis?
CT scan.
Hydronephrosis. Sorry?
CT scan.
Oh, okay.
That's it.
Ultrasound also would be good enough if you're
But-
monitoring the progression, but initial diagnosis might need CT.
Okay. So if somebody is getting recurrent UTIs, so does the person stand a higher risk of or a risk of kidney damage or a larger,
Definitely.
Yes, ma'am. That is a risk.
Definitely,
They have to diagnose. The reason for a patient is having repeated UTI is not be easily ruled out. They have to get investigated, minimal scans, culture. Is this patient male or female? The one you mentioned.
I can't know. The name is not given.
Urinary cancer would be if you are having only the urine infection, especially in an older lady, which is quite common, may not be a problem. But not all infections are just in the urine. Some of these infections affect the kidney, which we call pyelonephritis.
Pyelonephritis.
Shakti had mentioned it earlier. So if they have kidney involvement due to infections, yes, it can lead to loss of kidney function over a period of time.
A patient who's on 1 week's dialysis, once a week dialysis, does he need protein supplement as he does not eat either egg or paneer?
Dialysis patients actually require higher protein than CKD, other CKD patients. I'm assuming he's on once a week dialysis because his kidney function is still reasonably there. And so he must be on some kind of incremental, like they start slow and then increase it. Would still need at least 1 gram of protein per kg.
So I think I'll wind up now because we're also running out of time. Just one quick another question is like we all talked about kidney disease as a silent disease. So, but if at all at very, very early stage there is any kind of pain which is related to kidney, so where will a patient feel it? Like how intense would it be? I mean, just to alert the patient that it could be due to kidney.
If it is kidney stones you're talking about, ma'am, is it right?
No, it doesn't mention stone, just kidney.
Pain is not a usual symptom of kidney function derangement. Usually it's a stone or a problem with the blood vessel, blood flow. That's or the infection. This is the usual reason we have pain in the urinary tract or the kidneys. Otherwise, the kidney failure or kidney function decline doesn't present with pain.
Okay. So I think I've tried to squeeze in as many questions as possible, and there are still quite a few left unanswered. So maybe the panelists, you could all take it up directly and answer them if you wish. So kidney disease, as we all understand, is indeed a growing global challenge, and it does require a very patient-centered care, focusing on equitable kidney health and also sustainable kidney health. So thank you, doctors, for agreeing to join this very interesting webinar on kidney care awareness and prevention and share those very valuable inputs with the audience today. And thank you, audience, for sending in so many questions. Today's webinar was jointly presented by the Kauvery Hospital and the Hindu as part of its wellness series to mark the World Kidney Day tomorrow. Thank you all.
Thank you, Babu. Thank you, Abhirami. Thank you, Shakti.
Thank you, everyone.
Thank you.
Thank you.